The slide shows the survival rate after vitrification of oocyte 4 to 8 cells and the blastocyst stage by cryotic method from 2011. So since I first developed this method, so we have already experienced 2,000 clinical cases in 5 IVF centers under my supervision, still obtaining 100% survival. So the graph is boring but exciting. The slide shows the oocyte before and after vitrification. So I have used this photo for these 10 years since I first published it in Japanese Society in 1999. So there's 3 oocytes here, and in the right, there's 3 oocytes after vitrification. So they look the same. So many people at the beginning, many people said the master did copy and paste in the computer, but it is not. So when I published it, no one believed in Japan. When I published it in United States or Australia, no one believed. But now, so 98% of IVF centers use my technology, and everybody believes this one. And after giving ICSI, 50% of fertilized oocyte develops the blastocyst stage, like this. So that slide shows excellent clinical reports of cryotech and cryotop and cryotech method as evidence of repeatability. So not only me, so my pupil or my student, my friend produce and report very good results, same as ours. And the static, he's embryologist of Advanced Institute of Fertility in Milwaukee. I visited there in 2002 and stayed there for 3 days. I trained her, and she obtained very good high survival of oocyte purification, and she obtained the first baby in United States, 2003. And 2003, I also visited Lucena in Bogota. And I stayed there for 2 days. I trained the embryologist there, and she obtained the first baby in Latin America. Also, I was invited to IMI, the speaker, excellent speaker today, Institute of Mexico Infertility. I stayed there for 3 days, and they obtained the first baby in Mexico 2005, and they also produced very good results. And also, I was invited to EB, and I'm supervisor of the EB. That's the largest IVF center in Europe. Anna Kobor, she learned the technology from me, and she obtained the first one in Spain, 2006, and reported 2007. And also, Antinori, I trained in embryologist is her center, and produced very good results. Can we time out? Can we come back? And since last year, so IMI in Mexico, they produced very good results using cryotic method. And to my best knowledge, so far, more than 40,000 healthy babies is delivered by cryotop and cryotech method so far. This is the first baby in the United States. It's called Sophie. It was born in May in 2003. And this is the first egg bank in the United States, Milwaukee. We set up it in 2002. And using this technology, so we established the oocyte bank for cancer unmarried women. So the first one was a high school student. So I established the first oocyte bank for cancer patient, unmarried cancer patient, and named it Future Mother. I really pray this patient to be mother in the future. Always got balance. Sorry. So the first case was in 2001. Then to date, we have already vitrified more than 1,000 oocytes, like from cancer patients, from 254 patients. And when the calculation, the number of the oocytes per patient is 4.3. Okay, so this young patient, they have only 4 oocytes in their whole life. So we need. I feel I needed the 100% survival vitrification to give the baby in the future. So we have kept the giving the hope for the family future for this patient for these 10 years. And then last year, we obtained the first baby from the cancer patient. And this is a baby, this is the first baby from a vitrified oocyte of a young leukemia, a married leukemia patient. We obtained the oocyte from 6 oocytes from a patient and preserved in liquid nitrogen for 6 years. Then after BMT, bone marrow transplantation treatment, she meets boyfriends, they married, and then she got the baby last year. Now she is not the future mother, she is present mother. And 3 more patients become mother this year. I'm very happy with that. Just some options. So other applications of oocyte vitrification. Okay. So first is non-simulation cycle IVF. I'm supervising one center in Turkey. So they use completely natural cycle. So patients come to the IVF centers or each cycle, then take only one oocyte, then vitrified. And if the oocyte number was more than 3, okay, after 3 or 4 times retrieval, then they saw all the vitrified oocyte, then giving ICSI and ET. And second one is fertility preservation of GID patients. So 6 transit patients from FTM, female to male patient. In Japan, also so many people change their sex. So we can vitrify the oocytes at the GB stage with humoral cells at the surgery of sex reassignment. And third one is the O-plasma vitrification. So we have started, as I told you yesterday. So we started the GB transfer to de-Japanite of all the defective oocyte from the woman over 40 years old. So we need the healthy O-plasm. So O-plasma vitrification, it means the cytoplast vitrification. And for the donor to keep their gene for the future use, so you also vitrify the GB karyoplast using a cryotic system. This is our new application. Okay, this is our center. It's located in Shinjuku, Tokyo. So this is Lipro Support Medical Research Center. So we last month we also established the Lipro Self Bank. So we invite the director, we invite Dr. Kagawa as a director of the Self Bank. So this is a fertilization preservation center for any cases for anyone. And this is, as a previous excellent speaker introduced, this is IMI, Institute of Mexico Infertility, the largest IVF center in Mexico with high advanced technology. So we are establishing the GBT center, GB Transport Center in Puerto Vallarta. So we are doing the piezo GB injection for IVF 40 to 50 years old patients. And also we established the International Advanced Fertility Preservation Center for anyone. This contained oocytes and GB oocyte and ovaries. And this is Yanhi Hospital. So we start collection of the healthy O-plasm. Yanhi Hospital is famous for the world's largest plastic surgery center and also SRS, sex reassignment surgery center. So they're doing ovarectomy, so we vitrified GB oocyte and GB oocyte cytoplasm and GB karyoplast in here. So one-hand survival can be obtained by the right protocol and the right tool and the cell quality. So if the oocyte and the embryo or blastocyst were recovered during equilibration step, so you can expect 100% survival after warming. Depends on cell quality. If it is normal, you will never kill any oocyte and embryos using cryotech system. Sorry. Oh, how can I do? Okay, just sorry. So it's irregular. I checked it was normal as a preview room. I'm sorry. So can I explain? That slide shows the number of the revitrification of human oocyte. We prepare 1, 2, 3, 4, 5 oocytes, 5 discarded oocytes. Then we vitrify 5 oocytes. Then after warming, if I confirm it is surviving, then we give vitrification in the same oocyte. So vitrify and warm, then culture 2 hours, then vitrified and warm, cultured, vitrified. So we examine how many times can we vitrify revitrification of oocyte. So number 1 oocyte. So this oocyte died at the time of 20 times of vitrification. So we can vitrify this oocyte for 19 times. Second one, 25. Third one, 15, 24, 27. So in average, 22 times. So we could vitrify oocyte for 22 times, same oocyte, if we use the correct light protocol. So in jokes, we say this means 2,200% survival. Okay. So I mean, the 100% is not very difficult. Okay, in conclusion, optimized 100% survival vitrification was established in 2011, and extremely preferable results begin to be reported for human oocytes and embryos in some advanced IVF centers in the world. I wish this successful vitrification would promptly spread worldwide, not only for the common infertile patients, but also for cancer women and transsexual people to realize their dreams in infertility towards a happy future life. Thank you very much.